did my taxes. I went with my dad to his friend Bolin, and he did like 4 years for me because I had to do 4 years, and then I had to do taxes for my mother because she like passed away in '07, and I thought I didn't know I could do her taxes, so I could do them, get a return as well. So.
Yeah. Oh, even like until now, you're getting returns on her behalf.
Yeah, pretty much. What Bolin told me was I could get all her for 2007 what the government would owe her, and apparently I'm entitled to her Canada pension plan. So
nice.
It's gonna take like 2 extra weeks to do all the paperwork. So that should be nice.
Yeah, that's pretty good.
Yep.
So you get a pretty good tax return after.
For 4 years, should be about 1,000, maybe 1,500. I'm not sure, somewhere around there, something decent.
Yeah, that's pretty good.
And then maybe an extra 1,000 with my lump taxes, and then I don't even know what the Canada pension plan stuff is, but all in all, maybe 2,000, I would say.
It's not bad. So how's your what do you call it? That syndrome, bowel syndrome thing, yeah.
Oh my God, IBS. Holy, yeah. That is. All I have to say about it is like, never get this. You know.
Yeah, I was reading a bit of it, and it sounds really painful.
Oh man, seriously, I've only had it going on for a year and a half, but pretty much I had to change my entire diet.
Okay.
You know, mostly fruits and vegetables, some meats and things of that nature. I have to do yoga stretching in the morning, things of that nature. But yeah.
So what was the cause of it? Like, how did you get it?
Okay, the precipice of this was an antibiotic called Macrobid. It was for a bladder infection, and from that point on, I was not the same. I spent the first 6 months throwing up like 3 times a week.
Okay.
And going to the doctor, my home doctor failed big time because she didn't believe me.
Right.
He's like, oh, it's anxiety and depression and all this other crap. And for 10 months, I wasn't sent to a GI, a gastroenterologist.
Right.
10 months.
Right.
Then I was put on a 4-month waiting list to see one. So it took almost a year to see the specialist, which is stupid. So.
Yeah.
Yep.
Is this something common, or like, do a lot of people have it, or?
Okay. Well, from the statistics I was reading, this is American statistics. I don't know if I can extrapolate for Canadian population, but in the States, I think 20 or 25% of the population has some symptoms of IBS, lifetime symptoms.
Right.
So it affects about 25 or 30 million Americans. And it can be triggered by injury, medication, sometimes stress, but mainly it's from medication side effects and injuries, like traumatic injuries, like car accidents, things of that nature. So.
Right. Wow.
And the medications take weeks to work, and it only relieves symptoms in a minor amount. So.
And then
it's mostly about diet change and exercise.
Does it
pretty much it.
Gradually go away after, or did you just?
I'm still dealing with tension and cramping and things of that nature, but generally, I was also giving low doses of Ciprolex, so that's helped a lot. I've been on that, I would say, for 2 months. So.
Yeah. Man, that's serious.
Yeah. What about you? How's your health?
I mean, like, I had that surgery, which was like last year, where my blood vessels were messed up, and to the point where my my cheek was like, it was like a big bulge, and like I didn't even notice that until like a couple of years ago, where my sister was like, "What's wrong with your face?" And then I'm like, "I don't know." And then I went to doctor after doctor after doctor, and then after many MRIs and like X-rays, and like nobody could find out what it meant, like what it was.
Well, did you need a blood test? Like, I'm sure they must have ran the basic blood work, and it came back negative.
Many blood tests, and then they still couldn't find out. And then finally, I met a doctor at Toronto General, and he figured out what it was, and then I ended up having like a surgery where I was like out for about a month or so, 2 months actually. And yeah, so everything is good now.
Was it a clogged blood artery or something? something in your face, or swollen muscle?
It was like a kind of like a broken, almost like a broken blood vessel that needed to be fixed. It was most likely I was born with it, and as I grew older, it started getting worse.
So it didn't repair properly, and it just kept reforming and changing, not repairing properly and swelling up or something?
Right.
Okay.
Yeah. And it was so noticeable too, like my side, the left side of my face was like bulging.
Was it painful?
No, that's the thing, it wasn't painful. That's why I didn't really notice it.
Okay.
Yeah.
You figure it would be. I mean, you would have a bulge, if you press on it, it wouldn't hurt. It just felt normal, right?
I would sleep on it. I would sleep on it, and I wouldn't really feel anything. I would feel like a pulse, but I didn't think much of it.
Mm-hmm.
Yeah. I'm just glad it's gone now. I have a bit of my stitches are still there, my scar there, but that's okay.
And at Scarborough General, a doctor figured it out?
Toronto General. I went to...
Oh, Toronto, good. I was about to say, Scarborough General is terrible.
It's horrible, man. It's really horrible. They don't know what's going on.
Yeah. So what did your home doctor say? He or she had no idea?
My family doctor was like, it just gave me medication and it didn't do anything.
Well, what was this medication? Was it a cream or a pill or something?
It was just a pill.
Oh, yeah. Family doctors have been failing lately, so...
Yeah, especially mine's.
I don't know. I think mine probably failed worse, so... Yeah.
Jackie, have you ever had any, bad medical experience in your life?
No, not
really. You're a healthy boy?
That's good.
That's good, yeah. Of course, and then I remember when I was 16 too. I had to go for surgery because when I was born, I had this thing called a shunt to help blood flow in my body. When I was born, right? So when I was 16, I was walking kind of funny, and as I grew taller, I couldn't really touch my toes, so I had to go to sick kids and get that taken care of too.
What did they do?
They just had to remove that that shunt thing that was on my back, so that went out. Then I was fine after that.
Okay, that's good.
Yeah.
I honestly, other than the IBS, I never really had health problems. The only other health problem I had or injury was back in I would say junior high. I was playing King of the Hill, and my friends threw me off a hill, and I dislocated my wrist. That was terrible.
Shit.
Yeah, my wrist. You know where your wrist is located?
Uh-huh.
I always tell people with that injury, my wrist would normally be with 5 centimeters below, where it should be.
Right.
I realized that when I looked at my wrist when it first happened and I didn't feel it, I was like, well, my wrist shouldn't be there. It should be there. So then it was an 8-hour wait at Scarborough General with no painkillers.
Did you have to get a
cast?
My arm. Did you have to get a cast or something?
Oh yeah, I had the full elbow cast for no reason because another doctor saw me and he's like, your elbow was kept in a bad position for 4 weeks for no reason because I had to go through rehabilitation, moving my arm up and down.
Okay.
But all that needed to be casted was the wrist part. So, and then I had to learn, no joke, I had to learn how to write with my right hand. So I became, what is that term, ambidextrous, I think?
Yeah,
that term where you can write with both hands.
Yeah, something like that, yeah.
That was terrible. I had to learn, literally, I had to do science exams and things of that nature with my right hand.
Oh, so you were left-handed before?
Yeah, well, I could do both now, but I generally write with my left hand.
Oh, that's good, yeah. Same here.
Yeah.
Yeah, I think it was in grade 2 where some kid, I was with my friends, and one of them kind of pushed me, and there was another guy kind of on all fours, and then I kind of tripped over him, and then I broke my arm after that. Yeah. I had to get the full length cast too, and for some reason I'm double jointed after that too. I can do crazy.
You know what? That's the same thing with my wrist. Ever since then, my thumb could touch my wrist or whatever. So I guess that's double jointed. I guess there was only one other injury I had, and it was stupid. Actually, I